In this video, we discuss the use of ivermectin during cancer treatment. As always, these ideas are discussed in more depth in the book Cancer Self-Defense 101. Quick tips to help you survive. All citations for studies quoted in this video can be found in the book's bibliography at cancerselfdefense101.com. This video is intended as information, not medical advice. It is not intended to treat, diagnose, or cure any disease. Any medical advice should come from an appropriately credentialed medical professional familiar with your unique circumstances. Ivermectin is an anti-parasitic drug approved by the FDA for human use in 1978. It is used by over 300 million people annually. Its anti-cancer effects have been studied since 1996, but incredibly, it has no human studies or population studies regarding its effectiveness in cancer. There is a case report in 3 people that points towards effectiveness. However, there are numerous animal and cell line studies, as well as widespread anecdotal support amongst researchers and patients who believe in drug repurposing. It was found to synergize with anti-PD-1 medications to fight triple-negative breast cancer in a mouse model, eradicating it in 40 to 60% of cases. 75% of the mice treated with ivermectin and anti-PD-1 were long-term survivors, as opposed to none from the untreated group and 40% from the immune therapy group. This is the first time we can show that by adding an inexpensive, existing safe drug, you can make breast cancer treatable with immune checkpoint therapy, said Dr. Peter Lee, lead author of the study. It's the 2 drugs working together that is the magic. Either drug alone has almost zero effect, but together they have a powerful synergistic effect. Ivermectin also greatly increased the helper and killer white blood cells penetration into the cancer tissue. Ivermectin is an ionophore, meaning it helps transfer ions over cell membranes and thus increases membrane permeability. Ivermectin is also able to kill cancer stem cells, the most vital and difficult part of cancer to destroy. It kills them with approximately the same lethality, or greater, as the widely used chemotherapy drug paclitaxel, but without toxic side effects. Again, as harvesting resected tumors for tumor-infiltrating lymphocytes, TILs, comes closer to being a reality, the penetration of tumors with white blood cells will become increasingly important. Additionally, ivermectin triggered the cell's death by immunogenic cell death, a newly discovered form of cancer cell death that triggers a T-cell response, as opposed to apoptosis, which does not trigger a further immune reaction. In just one study, ivermectin was tested against 28 cancer cell lines and showed efficacy against all of them. 2 of the 4 lines it showed the most efficacy against were triple-negative breast cancer lines, a notoriously difficult cancer to fight. In mice injected with the same tumor lines, ivermectin reduced tumor size and burden. It was also found to synergize with the common cancer medicines, docetaxel, cyclophosphamide, and tamoxifen. Ivermectin has been found to consistently reduce cancer drug resistance. It is incredible that there is virtually no clinical human data for ivermectin regarding cancer. It is equally surprising that there are no active clinical trials underway looking at ivermectin's effect on cancer either. It looks like those waiting for clinical trials will have to wait years more. For more information, please see the book Cancer Self-Defense 101. Quick tips to help you survive.